Good morning and welcome to this press conference. I certainly appreciate everybody's attendance and participation here this morning. I'd like to introduce individuals who we have with us. We have the Senate Majority Leader, Senator Duff, the Republican Majority Leader, Senator Len Fasano. We have the co-chairman of the Insurance and Real Estate Committee, Senator Tim Larson. I also have with me Senator Tony Boucher and Senator Len Suzio. We also have Senator John Kissel. In addition, we have a number of advocates that are with us here this morning. We have Christine Palm, who's the Communication and Women's Policy Analyst for the Connecticut Commission on Women and Seniors. We also have Katherine Bailey, who is the Deputy Director of Connecticut Women's Education and Legal Fund. We also have Frances Padilla, who is President of the Universal Healthcare Foundation of Connecticut. We also have Gretchen Bravo, Director of Policy, Advocacy, and Strategic Engagement for Planned Parenthood. This morning we're here to talk about Senate Bill 877, which is an act authorizing the qualifying event for pregnancy as a special enrollment period for women. What the bill will do is it will allow an uninsured woman to obtain health insurance upon the diagnosis of a pregnancy. And what this will do is will allow the individual to access important health care insurance to make sure that she gets proper care, as well as proper prenatal care. And we know that with the addition of that insurance and care, we will not only improve the health of the mother, but also through her delivery, and by doing so, reduce the cost to both the family and the baby. So that's what's important, is to make sure that everybody gets the insurance that they need to make sure that they have the care that they need. But also, why is this needed? Presently, under the Affordable Care Act, the essential benefit includes pregnancy coverage. And if somebody is on Medicaid, that also would allow the person to get the care that they need. But we have a lot of families that are above Medicaid limits but can't afford insurance. Many of us have heard about the Alice families in Connecticut, the asset limited income challenged employed. This really would go to those families, individuals and young individuals that have not participated in purchasing insurance, and now we would be able to make sure that they get the coverage that they need as they move forward with their families. So this bill is important to make sure that those individuals get the care that they need, and particularly the prenatal care. We are excited this year. This is the second time that the General Assembly has seen this bill. And this year it passed out of the Insurance and Real Estate Committee with bipartisan support. So we're very hopeful that going forward we can garner support in the Senate and then hopefully in the House to make this law in the state of Connecticut. With that, I would like to introduce the Democrat Majority Leader, Senator Bob Duff.
Thank you, Senator, and thanks to you and Senator Larson for your work on this bill. I just want to say that I'm glad that it's a bipartisan bill and one that looks like there is certainly an amount of support for through the Senate. More of my colleagues would have been here today, but we're in the middle of a caucus right now, which I need to get back to. But again, I wanted to certainly express the thanks for inviting us to this press conference. Thanks to Senator Kelly and to Senator Larson for their work, and certainly to Senator Fasano for his work on this as well. I think that we can work to make this a good bill, and it's a bipartisan bill, and glad to be a part of the conversation. Thank you.
Now I'd like to bring the advocates up to say a few words. We'll start with Christine Palm.
Thank you, Senator. In addition to being terribly important to the health of a child, I wanted to focus on the importance to this bill to women's pre- and postnatal care for two very specific reasons. Women who are unable to get prenatal care are logically unable or unwilling or unavailable for postnatal care, where postpartum depression and anxiety are often discovered and screened. This affects 15% of women who've had a child, according to the Centers for Disease Control. It's a very real problem for a lot of women, and physicians and clinicians can pick up on this during prenatal care as well, the warning signs, and certainly in the postnatal care. Another very strong benefit of this bill, of getting women into prenatal system, is the detection of domestic violence. Physicians, nurse practitioners, clinicians often pick up on signs of domestic violence, and women who are pregnant are at greater risk for being abused by an abusive partner. In fact, homicide is the second leading cause of injury-related deaths for pregnant women. Studies have shown, and this is coming from Connecticut's CCADV, when women in prenatal care who are being abused get the counseling they need, they are 60% more likely to end an abusive relationship. So that is another very, very important reason to get women into this track of early care, because the insurance is not only important for the health of the baby, but the physical and mental and possibly even the lives of the mothers. Thank you.
I'd like to introduce Senator Tim Larson, who is the co-chairman on insurance and real estate.
Thanks, Senator Kelly. This is a common sense bill that pregnant women should be given access to care they need to ensure health of their children. Pregnant women do not receive adequate prenatal care or put at serious risk, as are their children, who can struggle with years of health complications as a result of inadequate care. I'm proud to support any legislation that helps more people gain access to health insurance, particularly to pregnant women. Thank you.
Thank you, Senator Larson. I'd like to now introduce Katherine Bailey.
Thank you, Senator Kelly. My name is Katherine Bailey, and I'm the Deputy Director of the Connecticut Women's Education and Legal Fund. QUILF is a nonprofit organization dedicated to empowering women, girls, and their families. For more than 40 years, we have worked to advance the role of women in Connecticut, and that includes participating in the Coalition for Choice, a group of advocates that's committed to protect reproductive choice and freedom in our state. Prenatal care is essential to the health and well-being of mothers and their babies. Regular prenatal visits reduce the risks of pregnancy complications, such as preeclampsia and diabetes, and monitor the healthy development of the infant. Limited enrollment periods are simply impractical for women who may not realize that their insurance plans do not include maternity care until they are pregnant, or who find out about their pregnancy after the open enrollment period ends. Frankly, I'm a bit perplexed that this is not already included in the law, and in conversations with friends and families, they were equally surprised to hear of this. No person should be forced to forego these critical services because the timing of the pregnancy doesn't necessarily align with the enrollment period. Without insurance, maternity care and birth costs are quite expensive. They can run anywhere from $10,000 to $50,000 and more. And this is an outrageous sum to be placed upon an individual. As others have said, Senate Bill 877 is common sense legislation that will increase access to critical care for expecting parents and their babies. So I'd like to thank Senator Kelly and the other lawmakers who stand here in support of women's health today, and we look forward to working together on this issue through the rest of session. Thank you.
Thank you very much, Katherine. I'd now like to introduce Frances Padilla.
Thank you, Senator Kelly, and the other members of the Insurance and Real Estate Committee in the legislature. I'm delighted to be asked to speak on behalf of Senate Bill 877. The Universal Healthcare Foundation of Connecticut, our mission is to work toward universal access to affordable and quality care. And this bill really does help help us on that pathway to the mission. There is, in addition to all of the health benefits and the social well-being benefits of people being able to get insurance during special enrollment period when they are realize they are pregnant. Clearly, when a baby is born in the hospital, that is a life event, a qualifying life event. But when a person discovers being pregnant and not having insurance, there is a great deal of anxiety that comes along with that, understanding that for the foreseeable future, one might be in debt. And we know that medical debt is a major reason why so many people are unable to advance economically. So I think that this bill also makes economic sense for the families. And we need to ask ourselves what truly is the purpose of healthcare policy, but to make people better off. This bill will help make families in Connecticut, their mothers and fathers and children, better off, both in terms of their health, in terms of their well-being, and their economic security.
Thank you very much, Francis. I'd like to now introduce Gretchen Bravo.
Good morning, or good afternoon. Hello, my name is Gretchen Bravo, Director of Public Policy and Advocacy with Planned Parenthood of Southern New England. At Planned Parenthood, we believe that every person has the right to control their fertility and plan their families, and have the information, education, and resources to do that. We want to thank Senator Kelly and all members of the General Assembly that are with us today in support of Senate Bill 877. We saw with the Affordable Care Act great advances in women's health care and health care coverage, including one of the important benefits it brought with coverage for pregnancy, maternity, and newborn care as one of the 10 essential preventative health benefits that must be included in insurance plans offered on the marketplace. We see that pregnancy care coverage has begun to positively impact our state's maternal morbidity and infant mortality rate. While many pregnancies are healthy and uneventful, pregnancy itself can trigger a range of significant health conditions, from diabetes to preeclampsia, that left untreated during the prenatal period may cause grave danger to the woman and her fetus. Planned Parenthood supports making pregnancy a qualifying life event that would trigger a special enrollment period. The serious health risks and high costs associated with pregnancy complications, the continued existence of plans that do not cover maternity care, and the fact that despite decreases in unintended pregnancy rates, almost half of pregnancies still in the United States are unplanned, making advanced enrollment less likely for many women, and making pregnancy a qualifying event for special enrollment a vitally important option. We heard already the enormous costs of maternity care and delivery. With medical complications, a cost of care and delivery out-of-pocket costs could be devastating to a woman and her family. A woman who lacks access to the insurance plan that covers maternity care may forego prenatal care altogether because she simply can't afford it. The American College of Obstetricians and Gynecologists estimates that pregnancy-related maternal mortality rate is 3 to 4 times higher among women who receive no prenatal care than women who do. The United States is the only developed country in the world where maternal mortality rate is on the rise, where black women in the United States die at least 3 to 4 times more than the rate of white women. This bill is one step in ensuring pregnant women get access to the quality health care they need, which will help prevent fatal complications during pregnancy and birth. We stand in support of Senate Bill 877 to provide further options to gain health care coverage during pregnancy and making maternal health a priority. Thank you so much.
Thank you very much, Gretchen. One thing I'd like to make a note here is that the House is in session. So because they're in session, we don't have any House members with us today. But what you have heard this morning is what the bill does, why it's needed, and that it is basically a common sense solution with a very positive impact. With that, we'll conclude and open the floor to questions.